I would say that, one of the factors in research of traumatized individuals, research specifically looking at re-victimization, one of the mediating factors of how frequently and how damaging re-victimization can be is dissociation. And dissociation is a sort of a reflexive response to trauma, to overwhelming stressors. And as small kids, when most people's traumas start, we have two responses to trauma: fight, flight, or freeze. And the fight-flight response is very activating and makes sense if you're a peer of the person. If it's a 40-year-old man who's the aggressor and the victim is 5 years old, the most adaptive response is to freeze, play dead. Animals do it in the wild. It's sort of hardwired into people's response repertoires. If that person has trauma that's unseen, unhealed, unintervened upon, that freeze response becomes hardwired neurobiologically into their brain, and that's how they show up in the world. And a big part of why re-victimization happens is because many times the freeze response in some way, shape, or form is active, or dissociation is active. And in organizations, in treatment settings, one of the biggest ways that manifests is the don't talk rule. Don't silencing, and that happens in many different ways. Patients come here all the time and say, "Are you sure it's okay for me to say I was suicidal last night?" Or "Can I say that I purged last night?" Or "Can I say that I'm thinking about losing weight?" Or "I'm thinking about going to get drugs?" And many, many treatment settings, there are specific rules about you can't say this and you can't say that, and you can do this and you can only do that. And that's sort of a setup for the don't talk rule and secrecy and silencing, which is where abuse lives, to grow. One of the things we encourage patients from day one to do is to speak up and to talk. Some patients literally can't do that, because they're so traumatized in the dissociation rule, and it was never safe to talk. So it can take time for people to be able to do that, but just having it built into the culture in and of itself is a protective factor.